All right, welcome back. When we left off with Dr. Savine, we were talking about how stress can actually affect your work. This is one of the items on this stress quiz that you give people. We took it here at WREX. Really interesting, and it's a little bit mind-opening. I don't think any of us realized quite how stressed out we really are.
It's almost an awareness scale.
It really is. It's about awareness. So another thing that it mentions here is poor attitude. I think we all know people at work who don't have the best attitude.
They suck the life out of you.
Yeah, now, so that comes from stress too.
It comes from stress also. It's really stress, it's the meaning that you give it, right? So things can happen in life, and if you give it a negative meaning, then that's going to create more stress than perhaps it should, right? Which in turn affects your attitude, which is driven by emotions.
So when someone snaps at you at work or acts like they don't like you, maybe they're
the odds are it has nothing to do with you.
Yes, exactly. Which is really hard, and I mean that causes stress too when you feel like other people are bringing that on you. And is it kind of circular then? Does it kind of spread between people?
It can be, yeah. It's again, as that occurs, you want to just kind of step back, take a deep breath, and then be very cautious about the meaning that you give it. So in that dynamic, if somebody says something that's kind of snappy to you, it probably has nothing to do with you. It's them in a bad time or bad place, and the meaning you're giving it is it's about you.
Yeah.
And it more than likely isn't anything to do with you.
Well, this is such a beast then, because it affects the people who are stressed out, and it then transfers stress to the people around them.
It does, yeah. You can do things too to break those patterns.
Okay, and let's talk about some of those things before we move on with the quiz, because this is one thing that you guys do is kind of address these. So how do you break that kind of pattern?
So in that type of pattern in, say, a stress environment or a newsroom where everybody's it's very high tension and very fast moving, there's deadlines and dire consequences if you don't meet them. Yeah. If, say, one staff member is short with other staff members, right, and they're consistently doing that, what you have to do is break that. It's called a neural pattern. And if you break that neural pattern enough times, they'll stop doing it.
So it's almost like you're training your coworker to stop doing that.
The more outrageous it is, the faster the pattern will be broken. So a silly example is something you could do is if you stick your hand on your head while someone's talking to you. It's rather distracting, right?
Really?
If they're talking in the middle of yelling, you just start doing this to them. It'll break that pattern. They'll start laughing, it'll break the pattern, and then if you do that consistently enough, it'll change the behavior they use as they're stressed out and how they react to it.
Now, what do you do when that coworker says, "What in the world are you doing?"
Yeah, well, it just helps if they understand what's happening. But
do
even if
you tell them, "I'm doing this because you're being a jerk"?
You could, but by telling them they're a jerk really doesn't help, because depending on the meaning they give it, right? Okay. So what you want to do is if they're talking more at you, right, instead of to you, if you tell them you want to break that pattern or try to lower that stress level, and again, you come up with something no matter whatever it is, the more outrageous the better. But if you just stick your hand on your head or on your nose or whatever it may be, a lot of times it'll break that pattern. They'll laugh, and I mean, even just with you in the moment there, you start laughing and your whole reaction changes.
It's really funny. Can you do something a little more subtle? Can you just crack a joke or something?
Yeah, you can. It can be as subtle as you want, but you really need to design it to be appropriate in the manner in which you're around. So in a newsroom or something on this, you probably can't yell things out because it might be heard on air, right? So it can be sign language, it can be a gesture, it can be, whatever you choose it to be.
Do you tell that person in your life why you're doing it? Do you explain it to them?
Oh yeah, our staff walks around. We've got almost 50 employees and 6 doctors, and when a doctor's flying off the handle about something in surgery or whatever, that you'll see a staff member right to the head, and it just stops it instantly.
So maybe this is something you could implement in your entire workplace.
Yeah, it does. It works very well. Yeah, it's called a pattern interrupt is what it's called.
That's really interesting. Now the next question, let's move on, because we've been talking about how stress affects you at work. The next question is, how does this affect your life? You talk about losing patience with your spouse or with your children, maybe cutting back on your household duties, or even refraining from participating in an activity or in sports.
Yeah, things you used to do that perhaps you're not. So the main one with that is you want to realize if you're not the person you used to be, or you could be, then it's time to make it a priority and get it handled. Right? Because it's not going to change. It's going to get worse, not better.
Yeah, and you can feel it in yourself. We've all had those days or even those weeks or months where you're not quite right, and you're just kind of surviving, and everybody's just getting on your nerves, and you don't know why they're all attacking you.
Women say that consistently here every week in the office. I don't know what's wrong. My doctor says I'm normal, my labs are normal, but I'm not me. And oftentimes you find subtle changes in hormones, and if they're just off just the slightest bit, it changes the whole dynamic of their behavior, their personality, and the way they respond. And
sure. Yeah. And that's not always just stress too, right? If there's something if you feel like you're not quite yourself, is it possible there's some other medical thing going on?
There's probably, the stress would probably be the precursor to it, or it would magnify it, right? So if the hormones are out of kilter just a little bit, you feel off, or you're not yourself, and you normally could handle the stress, and now you're not responding as you normally would. right? Something else is wrong, and that response is the way to let you know that you need to get it checked.
Yeah, I think you're right, especially women. We tend to, we say, oh, I just don't feel right. And someone will say, oh, you're fine. And then you think, well, it must be in my head.
Maybe I'm fine, maybe I'm having a bad day, maybe I'll be better. And next thing you know, it's been 4 weeks of bad days.
Yeah, one thing I watch Oprah all the time, and one thing Oprah always talks about is you get that little whisper first, like something's not right. And if you ignore that, then you get like a little pebble against your head, and then you get a brick, you know what I mean? So it's important to catch these things early.
Yeah.
So what advice would you have to people if they feel like something's wrong, whether it's stress or whatever, if they're just a little off? What do you do about that?
If it feels off, what you want to do is you want to talk to your doctor right away and let them know that you don't feel yourself. And then the answer is always not a medication right away. What you want is you want answers as to why it's happening.
Yeah.
Right. So the goal is not to just go get a medication once a month for the rest of your life.
Just slap a Band-Aid on it.
No, exactly. And it's not that medications are bad, but we want to get to the cause. Right. If we can't get at the cause, we can't create lasting change.
Okay.
Right. So we want to get at the cause.
Okay.
So that's always the first priority. If your doctor doesn't know, hug them and find another one.
Yeah.
Right. Yeah. I mean, they work for you. So there's an answer there. It just means they can't find it. Find another one.
Just keep on asking. Now, one of the things that you have on here is you're talking about participating in hobbies or sports. Why those in particular? Or is it just whatever you used to do in your life?
Usually as you become stressed out, it'll affect you either emotionally or physically. So if it's not affecting you physically, but it's affecting you emotionally, you'll start to pull back. You'll be withdraw from your hobbies or things you used to do with kids, spouse, workout, whatever that may be. And if you sit back for a moment and reflect and you're not doing things that you used to do that brought you a lot of enjoyment, there's a reason for it. You have to ask yourself why. Why am I not doing it?
Sure.
And it's probably not that you're too busy.
Yeah. And what's interesting, and I've been in this cycle before, there are times where if you get depressed or you're really stressed out, you don't really feel like working out. And by not working out, it seems like that makes it worse.
Makes it much worse.
I don't know if that's just in my head. I know if I don't
no.
exercise, I feel like just sitting on the couch. And if the more I work out and the more I exercise and I'm active,
the more you
it
want
makes me want to keep being active.
It's actually psychologically addictive if you do it 6 months. You'll
What,
do it for
exercises?
statistically, you'll do it your whole life if you do it for 6 months. It's psychologically addictive.
Really?
Yeah, the endorphins and the hormones that are released.
So
That's
that
the greatest benefit. That's why doctors want people to exercise.
Yeah, so it's not just about losing weight.
No, it's not about losing weight. And people that exercise will usually watch what they eat.
That's
right?
true.
Because they're going to the gym all the time, they're exercising. So it's not about losing weight. That's what you eat. You don't need to exercise, lose weight.
Well, I always feel like if I work out and then I eat junk food that I just wasted the workout.
Makes
so
it
just
a push.
to be more efficient, I'm like, well, I didn't work out for nothing. I better just eat a banana instead.
Sure.
Yeah, let's get down here then. So that was the last item on here. So right here there's a line, and we have a graphic for this too. It says if you checked any of these items, your body is giving you warnings. So anything from numbness or tingling to being moody, irritable, bad decision making. I mean, this is a long list of symptoms.
Yeah, absolutely.
I think you'd be hard pressed to find anyone who didn't check one of these.
Yeah, well, a lot of people will. The distinction there is it's happening for weeks on end.
Okay.
Right? So if you had a bad day, then perhaps it's a bad day. But if you're having several bad days followed by weeks, then there's probably something going on that needs to be handled.
So everyone's allowed one bad day once in a while?
Sure, once in a
That's
while.
fine.
Yeah, once a month perhaps.
So how do you tackle this? If a patient comes in, they take this quiz, they've got a bunch of check marks on it, what's the next step to kind of move forward?
What we always do is the patients come in and we let them vent and describe all the issues that they have and what's affecting their life. And then we set a plan based on what their needs are. So you always attack whatever's affecting your life most or the biggest problem is first. You set a plan and then you very specifically set dates that you want it resolved.
Really?
Yeah, absolutely. You don't ever miss a date. You set a plan and you set dates you want those resolved.
So what kinds of things are in this plan? Say you're snapping at your kids and your spouse, what kinds of goals would you set?
If they're snapped at their kids, then you take a health history and then you'd want something similar to that might be to pull a hormonal panel, right? And to find out why, the reason behind it. Right? There's always a reason, so you got to find out the why. And sometimes it's just taking a history of the patient and talking to them and finding out perhaps just the dynamic of the relationship. It could be a psychological issue, it could be a hormonal issue. There's always a reason.
Okay, and you guys actually do free evaluations, free stress evaluations, right?
We do,
to kind of get people started with this process.
Absolutely.
How does that work?
You can contact our office and they'll do a free health assessment and they'll walk through that history with you and you'll meet with a physician to come up with a plan and then dates and a resolution to it.
Okay, so is the whole process free then, or do you meet back in with the doctor?
The assessment is at no charge,
Okay.
and that's just to come up with an outline and a plan and dates to get it resolved.
Okay.
And then if you choose to, you're welcome to utilize our office. If not, we'll send you back to your own doctor or wherever you'd like to go.
Sure, so there's really no pressure. You're not getting
No,
sucked
not
into
at
a
all.
situation where you have to keep on coming back or anything.
No,
but
no,
it seems like this is a great way to kind of establish some better habits in your life.
Exactly, yeah. What you're looking for is the answers.
Yeah.
Right? Answers and somebody to assist you with a plan and give you dates. And then you go wherever you like. If you like us, fantastic. If not, we'll forward the information wherever you need to go.
Sure, and you know what, maybe ask your kids, ask your spouse or your coworkers if they think you need help. Tell them to be honest, because, you know, like you said, you might not realize it in your own self, but maybe someone
What you
else
want to watch is
see
their
it.
physiology. So when you ask them, watch for their the expression on their face and the delay of the answer. They'll tell you
Gotcha.
more than what the words say.
Very interesting. Well, let's put the information up on your screen one more time. If you are interested in one of these free stress evaluations at Savine Care Clinic, the number to call is 815-639-9900, or go online to savinecareclinics.com. We'll be right back.